comes to universal healthcare, we've had people trying to attack the Edu-Afya, program and all of the issues that had been raised by the teacher unions. But the government has sat down with them and is pleased to announce significant progress made in the health sector through bold reforms and decisive actions. In just 3 years, the government has expanded health insurance coverage from fewer than 8 million Kenyans to nearly 30.8 million. Under the Social Health Authority, approximately 65% of our population currently have been registered, and so therefore they stand to access essential health services, a substantial improvement from 16% coverage under the defunct National Hospital Insurance Fund. It's doing better. We have been able to disburse over 280 billion shillings so far, and that is really commendable. And we must tell the government story, because if we don't tell the government story, fellow members of the state, somebody else is going to tell, there will be this misinformation, disinformation, and malinformation. And that is why this office exists, so that we can come and speak and you ask questions and you're able to respond, and so that you're able to know what is happening. And so therefore, we have really improved from 16% coverage under NHIF to 65%. You can see that's a very huge increase of 49%, and that is extremely, admirable. Nothing like that has happened before. So the government remains committed to ensuring that every Kenyan benefits from quality and affordable health care. Further, the government is committed to transforming Kenya's education sector to meet the needs of today's economy and society, making sure every child and young person has a chance to succeed. The Social Health Authority, in partnership with the Ministry of Health and Teachers Union, have reached a significant agreement to improve medical coverage for nearly 350,000 public school teachers. This agreement eliminates core payments by removing system configurations that cause out-of-pocket expenses, ensuring that all contracted health facilities no longer charge teachers at the point of service. The agreement also expands healthcare benefits by providing access to specialized treatment abroad through selected hospitals in Turkey, India, and Saudi Arabia. Locally, this is very important. New services such as in vitro fertilization, IVF, have been added to better support teachers' health needs. And this is very critical, especially because of issues of people who may be facing challenges of infertility and getting children. Basically, let's put it across that way, getting children. So IVF now then becomes part of what can be paid for, because it's been extremely important, costing even up to 2 million shillings, depending on consultations. But now people are able to get that because there's a facility. There's a bill, of course, in the Senate, assisted reproduction, that is still being conversed about. And that's a very, groundbreaking, progress. A bill that was introduced initially by Millie Odhiambo and then Judy Sijeni, the former senator also. But now it's still going on so that we can resolve that matter once and for all. So this is very, very good news for those who are suffering in that category, because it has been something that has not been addressed before. In demonstrating ongoing commitment, SHA has cleared a backlog of 160 last expense claims, each valued at Kenya shillings 300,000, with payments set for disbursement promptly. To guarantee smooth implementation and continuous oversight, county-level committees comprising of SHA, the Teacher Service Commission, TSC, and union representatives will meet regularly to monitor service delivery and address any issues. Additionally, SHA is finalizing tariff negotiations with healthcare providers nationwide to standardize services and improve efficiency. This collaborative initiative highlights the government's dedication to supporting our educators by providing accessible, comprehensive, and quality healthcare. Tunaona walimu wakijaribu kusema kwamba ati wanaongeza ada zingine za huku kando kando kwa sababu hawajapatiwa pesa na serikali. Hilo sio jambo ambalo tunafaa kulisikia kamwe. Kwa sababu muhula uliopita tulipatiana pesa kabla watoto kuweza kuingia shule. Sasa hivi kabla watoto wajaingia shuleni tumetoa shilingi bilioni 23.4, 23.4 billion. Kwa hiyo mtu hafai kuwa anaenda anaweka pesa. Tunaona kuna shule fulani ambazo zimeweka ada nyingi sana. Kama pesa inafaa kuwa shilingi 50,000, inafika hata karibu shilingi 100,000. Hilo sio jambo ambalo tunafaa kuliona, kwa sababu wakati unafanya hiyo pesa haina uwajibikaji na wazazi ndio wenyewe wanaumia. Kwa hivyo tunatoa ilani kama serikali kwamba hilo jambo likome. Pesa tayari zimeingia katika shule tofauti tofauti, na tumeweza kuorodhesha vile ambavyo zinafaa kutumika. Hilo ni jambo ambalo tunalisitizia. Kwa hivyo watu wasitumie hiyo ili kuwatapeli walimu, wazazi na watoto, na kuweza kufanya bei ya maisha iweze kuwa kubwa zaidi kwa sababu ya zile gharama ambazo zinajitokeza. NEMIS has got very good data for anyone who wants to verify what is being done, because the government has been very keen to remove ghost students. There have been these problems where we don't know exactly the number of students we have, in a school, because that's now what people are using, to rip off the taxpayer of money. And that is the challenge that has been there, but that has already been done, dealt with the NEMIS program. For those who may want to know, NEMIS means the National Education Management Information System, that was launched as a successor to CHEMIS. In the event that a school receives funds exceeding its allocation, they are also supposed to notify the principal secretary through the respective sub-county director of education to initiate the recovery process. Conversely, schools that are underfunded should also do the same. So if you're underfunded for whatever reason, then it is important to talk to the sub-county director, who then, of course, will compile and forward list of such schools to the PS. And that program is existing. So anyone who has an issue with that regard, please, that there is a way to follow. See your sub-county director of education, and the rest will follow. The government is pleased to announce significant progress and reforms in various sectors aimed at ensuring that we have improved access at all levels of learning, from education to university. These efforts also extend to teacher welfare, digital systems, and health protection, ensuring a holistic approach to education development. As part of its commitment to supporting learners in public institutions, the government has released Kenya shillings 23.4 billion in capitation funds to support learners in public schools. The funding helps ease the financial burden on families and allows schools to provide necessary learning materials and support co-curricular activities. Primary schools receive Kenya shillings 1,400 per learner. The National Treasury has been disbursing these funds to the Ministry of Education each term, following a 50-30-20 distribution ratio across 3 terms. For the current cycle, there are monies that have been allocated into account 1 for public primary schools for learning materials. We have money for textbooks, maintenance, for exercise books, for teacher guides and reference materials, and also for stationery. It is very well broken down. We also have money released into account 2 to cover school operation costs. That is like support staff wages, classrooms and facility maintenance, school activities, local transport utilities like electricity and water, communication, environment, sanitation, and capacity building and board management meetings, contingencies, science and applied technology, and assessment and examination. So you can see quite a number of areas have been covered, in that regard. So anyone who is saying that our education system is not working, really, they are politicking. They are politicking with the system. And that's why we are saying all those hidden costs by teachers, by the head teachers, are wrong. Because if their reason for doing so is delayed capitation, disbursement, then it's already been done before even children and the students go to school. And yesterday we visited several of them. We were at Rosho, boys. We were at Githumu, boys. We were also at Jiris. And all of them, even the teachers confirmed that they have actually been able to receive their funding for this academic year. So really, there's no reason whatsoever, because there's a very clear, disbursement 50-30-20. And so people are now able to plan with what we have. Of course, obviously, there is need to increase these resources depending on the availability of resources through Parliament. But as of now, there is no reason to say that you cannot budget with what is already being disbursed to the school. The government, since taking office, has hired, so many teachers. We promised 116,000 teachers. We've done already 100,000 teachers. And we have been able to build over 23,800 classrooms and counting. And of course, we are still reforming the curriculum-based education and training. And we are in the process, of course, of building 1,600 science laboratories and strengthening the grade 10 uptick. There are teething problems, yes, but we are on top of the game, and we are doing so.